Childhood cancer, a dreaded diagnosis that impacts the most vulnerable. It makes up less than 1% of all cancers with more than 10,500 diagnoses in 2018. However, childhood cancer has steadily risen in the past few decades, causing more researchers to ask why it's a growing problem.
Childhood cancer is a rare disease. It's important, but it's still somewhat rare. And the expertise to study childhood cancer is also somewhat rarely distributed. So we can make the best progress, or the most progress, if we team up. And having the capacity to get grants for research projects that have multiple investigators at multiple sites in Texas really has been, in some ways, game-changing.
The Cancer Prevention and Research Institute of Texas has taken notice. CPRIT funding has helped establish centers of excellence to address childhood cancer. The Lone Star State is now recognized as a national leader, paving the way in understanding why children develop cancer and discovering more effective ways to prevent and cure childhood cancers with fewer side effects. From Dallas to Houston to San Antonio and West Texas with Texas Tech Health Sciences Center, CPRIT is uniting a cancer-fighting ecosystem. 12% of CPRIT's award portfolio is supporting childhood cancer projects, 3 times the federal funding rate.
Is a collaboration between us and investigators at Texas Children's and Baylor College of Medicine and UT Health Science Center in San Antonio. And that's focused on understanding the biology of a type of cancer called a sarcoma and trying to translate that information into better treatments. What it's really enabled is collaborations, scientific collaborations in research across the state.
It's power in numbers, creating a cohesive connection between cancer researchers across the state, allowing for a unique collaboration not seen anywhere else.
Where CPRIT really looked for cooperation between many centers to really impact things at a statewide level, both in pediatric cancers. The Greehey Children's Cancer Research Institute, led by my colleague Peter Houghton, is a prime example of that, acting as a hub with other collaborators, really helping to impact the burden of childhood cancers in the state of Texas.
And what CPRIT has done is been able to fund laboratory-based scientific research programs. It's been able to fund clinical research programs, and it's been able to fund programs focused on childhood cancer survivors and mechanisms to deliver that care across a broad area. So I think it's exactly helping to support the development of that type of ecosystem.